An apple a day may keep the doctor away, but does the saying also apply to a serving of apple cider vinegar? Social media influencers and celebrities have been touting claims that apple cider vinegar, a liquid made by fermenting apples, can help with weight loss efforts, lower sugar cravings, and reduce bloating. Is apple cider vinegar good for you? If you look at the ingredient label on apple cider vinegar, you will likely see one, or maybe two, ingredients: apple cider vinegar and water. But within apple cider vinegar, there are many components. Apple cider vinegar is apple juice that's been fermented twice. Its claim to fame is acetic acid, which forms during the fermentation process and is thought to have a variety of health benefits. Health benefits of apple cider vinegar. 1. Lowering blood sugar. One of the biggest health claims for apple cider vinegar is related to diabetes and blood sugar management. When you have type 2 diabetes, your body cells can't properly take up sugar glucose from the foods you eat. A few small studies have found that consuming apple cider vinegar after a meal could help lower your blood sugar, which could be good for people with diabetes and without. But don't expect vinegar alone to keep your blood sugar levels in check. To calming acid reflux. Gastroesophageal reflux disease, GERD, acid reflux. No matter what you call it, it's unpleasant. And if it happens to you on the regular, you're probably desperate for a remedy. Some people swear by apple cider vinegar for acid reflux. The idea is that because ACV is a probiotic, it can introduce good bacteria into your gut and lead to digestive balance that lessens your GERD symptoms. 3. Aiding in weight loss. Some people claim that apple cider vinegar has helped them lose weight, but the science isn't solid. Researchers once thought that acetic acid could help you burn more fat and change your body's appetite-stimulating hormones. That's no longer thought to be true, and there are no studies to prove it. But some small studies do show that apple cider vinegar can help you stay full for longer, which can curb the urge to snack for about 2 hours after eating. Are there any risks of drinking apple cider vinegar? Apple cider vinegar is acidic, so it's important to dilute it before drinking it. You can dilute it by mixing it with water or another liquid. Doctors say drinking apple cider vinegar regularly or without diluting it can cause side effects such as erosion of tooth enamel, damage to the lining of the esophagus, upset stomach. Apple cider vinegar can also change how certain medications affect your body. Some doctors recommend speaking with your doctor before adding apple cider vinegar to your diet. How should I consume apple cider vinegar? Now that we know the benefits and risks of apple cider vinegar, let's talk about how to incorporate it into your diet. If you choose to consume apple cider vinegar, here's how doctors suggest doing so safely. Use apple cider vinegar in cooking. Looking for ways to add apple cider vinegar into your recipes. Doctors suggest it can be used in salad dressings, sauces, marinades, pickling. Dilute apple cider vinegar in beverages. If you choose to drink apple cider vinegar, be sure it is diluted in another liquid. Doctors recommend mixing no more than a tablespoon of apple cider vinegar into an 8-ounce serving of water, tea, or another liquid. Don't drink more than 1 serving a day. How much should you take? There's no standard dosage of apple cider vinegar, so ask a healthcare provider how much is safe for you and always be sure to follow the directions on the product label. The evidence so far says apple cider vinegar is safe for most people in small amounts. A healthcare provider suggests starting with just a few drops and working your way up, if you want, to no more than 2 tablespoons per day.